So it's motor, touch, sympathetics, and pain. And that's all that the nerves do. And to remember all those functions of nerves, because quite a lot of you commonly would just say, well, there's a wrist drop, but not tell me that much about exactly what's going on with anything else. So we need to recognize that that's motor, touch, sympathetics, and pain. Might try something professional, MTSP. So remember, every time you see a nerve, you need to think about the mechanism. Has it been stretched, cut, bruised, lacerated? In the same way as trauma, was that a train traveling at 100 miles an hour, or were they just hit with a tennis ball? Those differences in mechanism are really key in trauma, in nerves, just as it is in bones. But then we assess all functions of nerve, because that tells us about exactly what's going on. There may be a motor drop with those big, heavy fibers being damaged, but if you can say there's sympathetics there and some light touch, then you know the nerve's in continuity, at least to some extent. Muscle function, we're going to come back to this later as I geek out, but how do we assess muscle function? I'll come back to this later. Sensation, we need to recognize when we're assessing nerves that it's quite complicated, the branching of that nerve. You all, I'm sure, know your brachial plexus anatomy, and it mixes up root levels. And the areas that get numb relate not just to the root levels. If the injury is not here in the neck, if the injury is further down, there'll be different patterns. And understanding this pattern of nerve injury as opposed to this pattern of root injury is very important in assessment. So please don't tell me there's a C6 injury if it's an infraclavicular injury. Sorry, there's a C6 dermatomal pattern if it's an infraclavicular injury, because it won't be. It will be an affectation of the lateral cutaneous nerve or the superficial radial nerve or the fibers, C6 fibers to the median. So think about that. Sympathetic, sweating, hair loss, rugosity of skin. I'm sure you all know this trick. But if you have a laceration of a digital nerve, if you put a wet dressing around a finger, really useful in kids, and come back, you'll see that the side that has a digital nerve gets crinkly when it gets wet. That sort of pruning of the skin that you see when you've been in the bath for too long. And if there's no nerve there, there won't be that same sign. Pain, neuropathic pain is really important. You all recognize those descriptors: lancinating, shooting, burning, squeezing. It is very difficult to treat, but there are a number of surgical diagnoses that are surgically amenable. So please, please don't go, and I think talks later we're going to talk on this, but please, please don't just go straight to the diagnosis of exclusion, which is CRPS. If there are diagnoses that you can make, it is not CRPS. Neurosthenalgia, symptomatic post-traumatic neuroma, causalgia, post-traumatic neuritis, all improvable, maybe not curable, but improvable with surgery. So just to remind you, mechanism, how is it injured? MTSP, looking at motor, touch, sympathetics, and pain, looking for a TNL. Neurophysiology and imaging, they're useful, but probably not like you would expect. They're not going to give you an answer if you haven't done all of that first.